morning, everyone, and welcome again to IHA's webinar series. Today's webinar is Weaving Empathy and Clarity into Health Communication. Our speaker is Romina Sperano, which I will be introducing shortly. For now, I'm going to begin with just a few housekeeping items. Make sure you connect to audio using your computer speakers. During the webinar, all attendee microphones will be muted, but please feel free to ask questions directly to the speaker through the Q&A, which is found in the bottom of your screen. If you want to chat with other participants, feel free to use the chat box, and that's where you could discuss other things. But if you have a specific question for the speaker, make sure that those questions are placed in the Q&A. If you're having some technical issues, feel free to send an email directly to support@healthliteracysolutions.org, and our technical support will try to work it out for you. Please note that this webinar will be recorded and posted in the Health Literacy Center, and you will be able to have access to the webinar recording and the slides. Also, following the webinar, you will receive an email by the end of the week that contains a link to a brief online evaluation. If you requested CEUs when you registered, you must submit this eval in order for you to receive your CE certificate. And with that, I would like to go ahead and introduce our speaker for today. Our speaker today is Romina Sperano. And Romina, if you would like to give a quick bio about yourself and the education, the practice.
Good morning, everybody. I'm very happy to be here. I am a translator, originally studied sciences, started in biochemistry, and through work with colleagues that needed help with translation and editing, I started working language, and through that work, it led me to plain language, trying to streamline the source texts that translators and editors were going to be working with. I work mostly in the medical area with medical instruments and healthcare, and now I am doing a lot of professional activities giving back. I'm at the Editors Association in the US. I am at the Translators Association, and I am currently on the board at Plain Language Association International, and I'm working on standards for plain language. Hopefully by the end of the year, or maybe early next year, we'll have the first ISO plain language standard. So that's very exciting. I am very passionate about writing and communication. So we'll hopefully have something for everybody to take away and be able to implement in their practice today.
Wonderful. Thank you so much, Romina. We're so excited for your presentation today. And with that, let's go ahead and get started.
All right. So the idea of weaving empathy and clarity has to do with the right to understand, and the fact that we have language. It's our unique human ability to communicate, to think, and writing has enabled us to heighten that ability. So we're going to go through this list of topics to hopefully help you have some tips that you can work through your communication practices. The right to understand is not just wishful thinking. It comes from the normative and regulatory work of a lot of organizations, and these are just some examples. The United Nations in their own identity establishes the right to health and well-being, the right to education, the right to participate in cultural life, in scientific advancement. Interestingly, also, the World Health Organization establishes the responsibility of governments for the health of their people. And this comes in now in the new definition of health literacy. As you know, we had right before the pandemic, a year of comments for a new definition of health literacy, which was before centered around the individual. And we made comments, and this is especially my comment on that definition. And luckily for Healthy People 2030, we went from that definition that appeared in Health Literacy, A Prescription to End Confusion, that report that was from the early 2000s. Now we have a definition that opens up the concept beyond the individual, and it requires organizations, or it puts some responsibility on organizations and professionals to equitably enable the individuals to have all those skills that were individual skills, the ability to find, to understand, and to apply the information that they need to make healthcare decisions for themselves, for their communities. And I'm hoping that this will also go to our environment, and it will connect health with the larger environment. As you know, I'm going to go through this very quickly. Lower health literacy is connected with negative outcomes in the health itself, in the misconceptions that are spread, in the use of emergency services and admissions to hospital, lower adherence to treatment. So we really want to go to the positives, elevate health literacy, both at the level of the individual and at the level of the institutions. And so this is where we're focusing today as professionals. And of course, I'm going to show this very, very brief video to remind us that health literacy is really situational. So that's another important takeaway, that we're not just dealing with people's set skills. It is something that changes and is dynamic.
Claire, there's no easy way to say this. It's advanced cancer. Now I know this is sudden and there's much to discuss. Her doing this?
This is all Elena.
Claire? Claire? Claire?
So in time-sensitive and stressful situations, somebody who would have a very high level of literacy in general can be really overwhelmed.
Claire.
So my way of visualizing this is putting the individual at the center, but signaling all the forces that also affect the way that an individual will understand and use that information. We are going to focus on some plain language and some provider skills, but we're going to take a look at some interventions in all of these areas. At the level of the institution, we need to have awareness, and sometimes that comes in the form of regulations. For instance, the Inter-American Tribunal has issued some guidelines during COVID-19, but it's also the European Commission has the mandate for lay summaries for clinical trials, for instance. But also we have very tangible interventions that we can do. For instance, in a hospital, we can change the way signage works and the way we direct people so that it's not overwhelming for the patients. At the level of professionals, we have resources. The OECD has a lot of research about skills, and some of their work has to do with understanding the state of affairs in order to issue policies, but they do have also materials that you can use. The Health Literacy Toolshed has a lot of quick instruments that you can use to help measure the individual health literacy of patients and loved ones. Sometimes we need to explain things to the caretakers of our patients and not to the patients themselves. The class standards, the culturally and linguistically appropriate services is important to keep in mind how we can approach patients and individuals that have other linguistic needs, other cultural needs, and be able to work with them towards better outcomes. And also the Multi-Regional Center works on different projects, and their health literacy project has a lot of tips for specifically for clinical trials, but that can be applied in other areas. One particular technique that I want to always remind people of is the teach back technique. And if you want to have a quick reminder, you can go to this web address and print out the steps. But really, it really helps to remember and have a little red flag in our heads when we're explaining things to people, or when we're having them read them, to read them out loud and use that also with written materials. The reason we need to intervene at this level, and I think that this is a very important topic that is not talked about enough, the issue of intelligence. Throughout the 20th century, we have developed a lot of measures of intelligence, and the definition that is used with some of those instruments is the ability to classify the world, to use logic on abstractions, and to consider the hypothetical. So it's a very, the ability to abstract and highly reflect. And we have, most of you probably have seen the bell curve that shows the distribution of intelligence across the population. And what's interesting about this is that throughout the 20th century, the instruments that measure intelligence have had to be adapted because people have gotten smarter. And we have been able to gain IQ points. However, in the last 25 years, we have seen a decrease in intelligence, in this ability to think through problems, to abstract, to problem solve. And this is called the Flynn effect, is the increase, and the reversal of the Flynn effect is the decrease. So we want to be mindful that we want to support people in their thinking ability. And even with the reversal, and I'm going to switch that bell curve to a more concrete way of visualizing this, we have this distribution of intelligence in the population, and yet the best measure we have of health literacy has this distribution of health literacy. Now, we know that, yes, health literacy is dynamic, but I think that with this mismatch that we see, we can do a lot to help at least bring health literacy to much better the level of ability that people naturally have. Of course, we need to think about the different participants in the health communication. And so I do encourage thinking about versions for written materials. And when we think about versions, we're thinking about writing in plain language. And really, plain language is the ability to go from this sense of bewilderment and confusion and horror, really, to a sense of understanding. This illustration comes from a plain language organization in Australia. And I added this little heart because I think that when things are clear, we can understand at first sight versus having to go back and ask for clarifications or make mistakes to learn from that material. And we'll talk about how one from one side we can go to the other. And the resources, the principles, and the strategies are developed by these organizations that you see at the bottom of the screens that work with plain language. So we want to help people not feel welcomed by a wall of text, but really be able to parse through and enter the text where they need. So plain language is defined as a way to write and structure and design documents to help readers find the information that they need, understand that information, and apply it in useful ways. So we have to think about the writing, each word, each sentence, each paragraph, but we also need to think about structure and how we highlight that structure with formatting, and finally, how we support that content with other ways of displaying information, for instance, with visuals. The principles that we follow to do this have to do with relevance or pertinence, accessibility, which means ways to let the reader access that material, and accessibility in the sense of the digital accessibility, and Section 508 is just part of it, but we want to provide a structure and the design features to allow everybody to access the materials and not feel like a wall of text. Intelligibility or understandability, which really has to do with two terms that I know are a little bit technical, textuality and adequacy, but I think that when we start thinking about textuality as how we build a meaning in the text, and adequacy as the tone, the register that we use, we start to understand that plain language can be applied to technical communication as well. And finally, we have a level of applicability that has to do with the planning, with testing our materials, and also with inviting our readers, maybe a sample of our readers, maybe we can do a group test to co-design with us. So as I think that there's a range of applications that go from technical writing, as I said, to even easy reads. A lot of these tips can be adapted to the use of controlled languages or the use of easy read for people that are second language speakers and need a simplified version, for people who have mental disabilities that also need a simplified version of content. And this is why I recommend versions a lot of times. And these are the types of versions that we can have. We can have a scientific article that, or the summary of a clinical trial in this case, with a version in plain language and something that has been adapted to young readers. This is simply an example of Easy Read. It's an organization in the UK that works with materials, and this is, for instance, their way to present information to people with learning disabilities or reading other reading needs. Now, where does empathy come in all this? We know from understanding how learning works that we need attention, we need participation, we need active engagement. Stanislas Dehaene, a French neuroscientist who works in psychology, has repeatedly throughout the past maybe 20 years emphasized these four pillars of education. And in understanding health information, we really need to pay attention to how we call attention to the text from our patients and how we have them participate. And I think this is a very good quote to remember. Stories are told in the body, and empathy comes from the body. It helps adhere to treatment, it helps care for others, it helps us learn, and it helps us care for our community. Why is it in the body? Because it really comes, there's a lot of research nowadays about the concept of embodied cognition, that we really, in order to learn things about the world, we really need to use our body, our brain, and our mind are not independent of the world. And one of the connections, the very important connections, is the release of oxytocin that helps us have empathy. There's a lot of research, and I put this cute little picture of the prairie voles because they have helped us understand that oxytocin really helps us connect with people. And also the discovery of special neurons in our brain that help us understand other people. Mirror neurons help us mirror what originally what other people were doing, but also what other people are thinking and feeling. And also personal neurons, neurons that track the space around us. And that all that comes into play when oxytocin is released. So we want to support that in order to make those connections. And one way to support that, to make a connection with our audience, is to use bias-free language. Language that is objective, language that understands that we may be sharing information from a particular vantage point, and not everybody may have that vantage point. So it's really imbuing respect in your text to get rid of prejudice or stereotype, or sometimes inadvertent bias, and we all have it. So we just need to be alert about it. And some of the guidelines that I like to use come from the American Psychological Association in their last edition of their style guide. They talk about how to talk about different categories that are of particular interest in terms of bias-free language: age, education, socioeconomic status, disability, even participation in research. When we recruit, for instance, patients, and we give them materials, we shouldn't say on those materials, the subject will comply with this and that. That is very cold, and it makes people feel like a number and not like a person who's helping the advancement of science. And we saw at the beginning that that's part of the goal of understanding. So how do we think about bias-free language? We think about whether what we are saying is relevant. Do we need to mention this? Do we need to mention age? Or maybe we don't. Do we need to mention race? Maybe we don't. How are we being sensitive to the community? How are we thinking about the intersectionality of people? We all belong to different categories. We're not just one single label. So if we're using a label, is that needed? Do we need to add another? And the specificity, sometimes we don't want to cast a wide net. We need to specify who we're talking about. So for instance, in a proposal that I worked on recently, the researcher was working with people with spina bifida, and in order to avoid, I guess, the use of normal, they created a fake category: conventional and unconventional. Conventional people would be those without spina bifida, and unconventional, and that creates a lot of confusion, and we should avoid that. Also, the idea of specificity, minimum wage for 2021 will be low. Low is a very vague category. So we want to be able to specify what is low. How are we defining low? Low is below the federal poverty line. And then we can go and look that definition up and see how many dollars that translates to. So for instance, in participation in research, as I said, we want to treat people as people versus especially when we're recruiting them, when we're talking to them. Of course, when we're talking to peers and revealing results, we can say participants, subjects, etc. And we really want to also specify words that may seem known to us, but need a context. For instance, the word risk. In terms of age, to talk about the different age groups, we can use specific ages, and if we are not working with the continuum and we are defining categories, then we need to specify that as well. In terms of disability, there's two different perspectives that are used. We can focus on the person, and so we can say a patient with epilepsy versus an epileptic patient. But we can also focus on the identity, and a lot of communities are reclaiming that identity. The blind, autistic, and amputee versus a person with an amputation. So we want to be mindful of what communities prefer, and also what is the most specific way for the purpose of our text. And of course, we want to try to, when we have the choice to use positive terminology instead of wheelchair bound, we want to use wheelchair user. And the images at the bottom of the screen point to the ICD and the DSM, which are manuals for diagnosis. And I want to call attention to something that a former member of the DSM developing team, Dr. Alan Francis, has been talking about in the last few years, which is the overuse of these manuals. And so we want to be very careful when we're using words about diagnosis, who did the diagnosis, and what are the consequences. And of course, one of the biggest consequences, medicating somebody who does not need medication. In terms of sex and gender, another huge category, we need to separate the needs of to talk about biological sex. Over 99% of the people are born with a binary category. There are hermaphrodite births. And you see the percentage on the screen. So that is one aspect. Of course, the other aspect is self-identification, sexual orientation, and all of the process of sexual development that has to do with not just with sex as a genetic variable, but also with a lot of input from other genes. And you see on the screen this variability in what's called single nucleotide polymorphisms that add to how nurture and nature interact for our sexual development. The brain plasticity, we have 86 billion neurons and trillions of connections, and that develops a long time and throughout our entire life. So that's a huge aspect of development that we need to take into account. And in particular, I want to point out, it's an interesting word. When we have a hermaphrodite birth, we talk about a chimeric embryo. There's an embryo that has is the merging of two possibilities. And even though the word chimera comes from a sort of fantastical creature from the ancient mythologies, these are examples of real chimera individuals in the world, and they can be beautiful, as you can see. So how do we choose terminology? We want to, first of all, try to be inclusive, also recognize when we need to use self-identified pronouns. And I was editing a report lately where the use of they was very tricky, because it was referring to all the different things that they can refer to, all the different types of people. It was being used in the plural. It was being used for an unidentified individual. For instance, somebody forgot their coat, That's because we don't know that somebody or somebody who self-identifies as non-binary or bisexual. So we need to pay attention to those things. We need to favor, again, specific terms. And if it's an encompassing term, we're using gay, we need to specify what that refers to. For race and ethnicity, they're both cultural constructs in the classification of life. As you can see on the screen, we do have a space for race or subspecies that we use mostly for domestic animals. Actually, zoology and veterinarians do use this term, but for the most part, there's no specific feature that lets us distinguish. So as cultural terms, we want to, we separate them because we use more physical features to distinguish race, more maybe linguistic and geographic features to distinguish ethnicity. But so if we're distinguishing them, first of all, do we need to distinguish them? And then can we compare them equally? Parallel construction is something that we always talk about in writing. Well, here it also applies. We cannot mix and match categories. We also want to avoid these overarching categories that we've inherited from the past. And we really want to be specific, again, that mandate from the guidelines to be specific and avoid false categories. And the dominant group, sometimes we have, is it dominating? Is it a majority? We need to be specific about that. In terms of socioeconomic status, again, we want to respect all those guidelines. What can we use positive terminology? People are really not illegal. They may be undocumented. People are not uneducated. We've all, barring some very, very extreme circumstance, we've all learned to speak. We've all learned ways to interact with our community. So maybe we haven't been schooled, but we're not uneducated. So all those little nuances we pay attention to. And where do we fit this in the process of writing? As the definition of plain language suggests, in the drafting, in the writing process itself, in the structure of our document, and in the design. So we go, and this is not for you to read, this is just to look at it, and that's why it's not even in English. We go from that wall of text to separating ideas, to creating ways to enter, to access those ideas. So now we have titles for the different sections in the form of questions. And then we can even highlight that with formatting and design, so we can help people. This is a text about preparing for a hysterectomy. So we want to give people access at different points in the text. Data visualization is a huge area. It was really launched by Florence Nightingale, a nurse who was working with soldiers in the front line. And she realized, and all this blue that you see on the screen shows that she realized that people were dying of infectious diseases and not of injuries in the line of duty. So she created ways to ask for resources. She created this visualization to ask for resources. So we can use that idea to show what we're talking about. Sometimes now the technology allows us to do so many things with visualizations. We can do charts and pies and shadows and everything. And sometimes a simple table is more informative. These are just some examples also of confusing visualizations that we can streamline, especially for statistics. Sometimes for people, like pie chart is really not very telling, and we can make that real with how many people are we talking about and how many people in that group are affected. In thinking about organizing structurally, not just with formatting. We want to think about all those patterns of organizations that maybe we used to use in middle school, in high school, cause and effect or question and answer, so that again, it helps us then organize and apply the formatting so people have access to the information in an easier way. And of course, then we get into the nitty-gritty of inside each paragraph, inside each sentence. We want to think about grammar. We want to think about cohesion. All those connectors do matter. Is it because it is before and after? Is it in a similar way? They help people think through explanations, descriptions. So here we have an unintended bad reference, guilt. I see that I had a little bit of the Spanish snuck up on me there. Guilt and bitterness can be destructive to you and your children. You must get rid of them. Of course, this is not telling us to get rid of our children, but that's the reference it gives. So we really want to use those cohesion strategies. We can use synonyms, hyponyms and hypernyms, words that mean something more specific, something more general, instead of the pronouns sometimes to point to the right reference. So guilt and bitterness are feelings. So that's a word we can use. We need to be very careful when translating technical terms for lay audiences, because we may need to readjust depending on the terms that appear. You can see here intravenous, intramuscular, subcutaneous, but then if we get intradermal, under the skin is not a good enough description, and we need to get rid of that one and come up with a different translation. So I usually suggest thinking about the dimensions of text, the textuality, building meaning, and the adequacy in terms of two axes. So here we have a technical text that's confusing. And instead of going to a lay text, that will also be confusing because we haven't worked with how we're building the meaning in that text. I would go first to a clear technical text. Migraine is a neurovascular disorder characterized by paroxysmal attacks of unilateral headache accompanied by symptoms of autonomic dysfunction. And this has a lot of shortcuts for specialists, and that's okay, but it's a lot more streamlined than the one at the bottom. So now from this text, we can go to a much more accessible text for a lay audience. Migraine is a type of headache that, and then we can use formatting, affects the nerves, appears on one side, causes these other symptoms. And so I'm going to show you real quick the process for this. And why do I say beyond terminology? Because here we're going from a technical text to a technical text. So terminology doesn't matter. It's specialists will understand all these terms. So instead of having this huge explanation between the subject of the sentence and its verb, we can streamline that. Mainly characterized is kind of too much because characterized already has the meaning that we're looking for. Sudden paroxysmal attacks is also, again, insisting on the same thing. Paroxysmal it means already sudden. And we see this a lot on in texts that come from recent graduates that really want to make sure they're conveying the meaning, and so they use an excess of words. So we can streamline all these into a clear technical text. And yes, we use, again, all these terminology. That is okay. Now, when we want to go from this technical text to a lay text, it's not just the terminology that matters. We can translate this to the text at the top with the text at the bottom, and I'm going to give you a second to read through. So here we have translated the terminology. We do not have neurovascular, we do not have paroxysmal, we do not have unilateral, etc. But it is still a very dense text. So we want to create a text that has points of access. And this is where we can end up. Migraine is a type of headache that, and identify the three aspects that were already crunched together in the paragraph, and also support this with an image. And this makes it also clear that migraines have, there's a light element, the darkness in the picture also points to the light element. It points to the one-sidedness of the migraine. So we have other ways to support. Before we open up for questions, I wanted to show you how all of this has come together, all these things that we take a look at little by little, and we can create a very different kind of text. So I'm going to let you read this, and then hopefully you'll be able to type in the chat the differences that you see between these texts. So I'm seeing already answers in the chat. Yes, bolding important words. And this is, we have bolding in the first text, but it's a different kind of bolding. And that's what you're noticing, that we have a text, and I'm going to pop up some of the issues that are coming up. Instead of coming at the reader as aggressive, yes, somebody just mentioned this. The title is different. Just security is very general. The title is a way for you to bring the knowledge of the reader to the table. There's a very, if you ever need support for changing a title, there's a very interesting exercise that Bransford and Johnson have made with a text about doing the laundry, and you can look it up. It will be online. How, if you don't have a title, you have no clue what the text is about. So a title is very important to connect, particularly to connect with previous knowledge and allow the reader to make inferences. So security, yes, it does bring certain aspects of, it's not any topic, it's security, but keeping you safe. Hours and visits is about, okay, this affects me, this affects my safety, and this is about some timing, and this is about connecting with other people. So that's already a lot of information from the title itself. There's no enforcement and prohibition that comes through at first. We are explaining the reasons why rules are there, and we are informing of those rules, and also we are understanding that life is not one way or the other all the time, and we have a way to get a pass to come home late. We have a way to get you connected with loved ones, and we are acknowledging the value of human connections when in the second text it says, we know it is important to maintain ties with friends and family, versus the other text was very detached. So all of these is we think through little by little about where does bias free come in, where does dividing the text into paragraphs and coming up with headings, subheadings, all those things. Here we have very little room, so bolding is a very good strategy if you don't have room for subheadings, for instance. So with this, the toolkit that you have is not just your subject matter knowledge. It is techniques in plain language, techniques in bias-free language, and reminding yourself to put yourself in the shoes of others. That's what empathy is all about. So with that, I am going to say thank you and open the floor for questions. Okay, yes, I am going to get that reference about titles. Let me pull it up. It's a really fun exercise actually to do with a group. If you I have one article right here. Let's see. Here we go. And if you look up Bransford and Johnson, importance of title or contextual importance of context, it will pop up. And there's a few different versions of it that people have done in replications of the study. So it's really a good, the link for the video. Yes, let me go. I'm going to put it up on the screen, the link for the video. The video that I showed you about situational health literacy. It's really an ad for from a cancer treatment company, and it's really powerful. The second part of the video is more advertisement feeling, but the first part is really powerful. So I just posted the link for you.
Thank you, Romina. I
Of
also
course.
wanted to remind, I noticed that there was a chat earlier about the Australian organization you referred to. Someone was asking about the image of the person reading with the heart on top. If you could share the link for that.
I'm not sure it's up anymore, but I can tell you that I can share the link of the organization that has it. It's right here. And just to link to the organization in Australia, it was not Plain Language Australia, but the standards organizations in Australia that submitted the proposal for a plain language standard at ISO. So we have a lot of connections with the plain language movement in Australia.
Perfect. I also noticed another question that came in the chat box, and they're asking, how can we talk about poverty thresholds using plain language?
So one of the things that happens when talking about anything that has to do with socioeconomic status, whether it's specifically poverty or education, we tend to conceptualize that in very general terms, the poor, the rich, and we need to be specific. So what do we mean by poor? What's our working definition that we can give? And again, for instance, in the sense, if we're creating a text for an audience that's countrywide, we need to go with the federal definition. And the poverty line is defined specifically each year. We have a number set. So we need to talk about that number or refer people to that number. If we are talking about, for instance, throughout this entire pandemic, we have had a lot of discussions in the school districts about access to technology and the fact that it has come to the forefront of the discussion in education, whether kids have access to a computer, to a cell phone, to a tablet. And so the idea of access, or the idea of poverty, or the idea of connectivity, all of those needed to be defined. Maybe somebody, if you need to have criteria, for instance, we had in our local school district criteria to have access to computers that were rotating in the different cities. What are the specific criteria? It doesn't help to say people without resources. What kind of resources? What do you mean? Well, and the questionnaire was, do you have a cell phone? Do you have a tablet? Do you have more than one tablet in your household? Things that speak to the specific situation and describe the situation in a tangible way. And so plain language and bias-free language combine in that area to be as specific as possible, again, when it is relevant. But in this case, yes, if we're talking about poverty, we're talking about access to technology to be able to do work for school, then all those questions are relevant and become part of the conversation.
Agreed. Another question, is there a library of clinical medical resources available on Easy Read?
That's a good question. I don't think there's a library per se. Change People, the organization, and let me go there and get you the link. Change People has resources that help for some to explain some conditions, and this is something that is developing. It's really it's a space that needs growth, that is growing. So I do work in developing materials for some of the hospitals that I work with, for instance, but we don't yet have a one place. Like, for instance, there's the Toolkit, the Health Literacy Toolshed that I mentioned for instruments to measure health literacy quickly, that need to be used with a lot of care and need to be contextualized, but they are there as a repository. We don't have that for Easy Read yet, but maybe that's something, whoever asked, maybe that's something that you can promote and help build.
And Romina, just wanted to let you know that if you could share that link to everyone. I think right now it's just a direct message, just so that everyone.
Oh, I'm so sorry. I thought I was going to. That's what.
That's okay. I've been trying to reshare the links that you sent because I noticed that it was just sending to me.
There we go. So Change People, the other ones, I'll give you.
Oh, I took care of the other ones already. I sent them to everyone.
Okay, perfect. Okay.
And then we'll take one last question, and this one is from Danielle Reeves, and it says, I teach health literacy for the County of San Diego. I also teach to use images whenever possible. However, especially with so much reliance on tech in the time of COVID, the issue of load time for images, SEO, and mobile compatibility keeps coming up, as images can cause issues. Have you found a way to resolve the issue?
So that's a very important question, and I try to use images when really the image will point to an aspect of the content that would take more time to explain. And it's using stock images is a lot of times an issue because they are big, because they're not specific. So ideally, we would want to have an illustrator working with us that can create an image that is specific for that content. A lot of times the icon style versus a full-on, colorful photograph, which are beautiful, but take time. Definitely, I also try to be very mindful of if people do print, and this is something that we have found in our area, people do print things that they receive. If it's a link or if it's a message with a PDF, they will print it. And if they're printing, you don't want to waste in color. So the using icon style, making sure that it's not just decorative. And sometimes one of the things that we do with one of the hospitals I work with locally is we have an image online, and then when we have the print version, the images are stripped from that. So those are workarounds. Of course, we want to think about how we describe that image for digital accessibility when people are accessing online. So there's definitely several dimensions. But trying to use all the technological resources that are available for compressing those images and making them as small as possible, it's part of the process, because as much as we would love to have these wonderful photographs that are big and colorful, we need to be realistic as well about how people access that, the time that it takes, the ink if we're going to print and such. Oh, thank you, Danielle. And
thank you so much, Romina, for answering these excellent questions. And I feel like that's very helpful, your responses to all the attendees. As far as any other questions, I think we're good for now.
So Scarlett, I know that we are coming
yes.
up to Health Literacy Month, so I know you wanted to share this.
Yes. Okay. Thank you so much. I just wanted to share with everyone that we have events during Health Literacy Month. And one of the events is the Global Health Literacy Summit, which is going to be October 3rd to the 5th. And you could register. I provided the link there. We also have a Health Literacy in Action Conference, October 14th to the 15th. The link is there. And another one, which is in November, which is, not Health Literacy Month, but also very close, is the Health Literacy Annual Research Conference, HEART Conference. There's a link that you could register as well. And the last bullet point is to help you prepare for Health Literacy Month, we've created a new resource toolkit, and you can find this on the Health Literacy Month website. And in that website, you will include ways, to build awareness for yourself, your organization, and also to provide, to get a toolkit, which includes social media graphics, newsletter information, videos, a handbook, print resources, even Zoom backgrounds. So use these days to go to that website and help promote Health Literacy Month. And also, if you're able to post some action ideas, we have like a discussion thread of what ideas you have planned for Health Literacy Month, and it would be great for others to know, and maybe they could model your own ideas. And I would just like to end this by thanking everyone for attending, thanking Romina for such a great presentation. By the end of this week, I just want to remind everyone that you will receive an email containing a link to the overall brief evaluation. And if you're requesting CEs, make sure that you submit this evaluation in order to receive your CE certificate. We will be sending the slides and the recording. They will be posted on the Health Literacy Solutions Center, and the link will be provided on the follow-up email. Thanks,
Thank
everyone.
you so much, Scarlett, and thank you, everybody. My email was posted, and I can send it back if anybody has questions afterwards. I'll be happy to connect.